in New Jersey, in your township, the Montgomery Township, but just overall in the country. So let's start this interview just discussing the cases and deaths your township is seeing currently. Are you seeing a downward trend as we're seeing across many states in this country?
Definitely. Yeah, it was quite high around December, end of December, January. The numbers were quite high, but we have seen a decline in rates of infection. And I think it definitely has to do with the numbers of people who are getting vaccinated against COVID-19.
Yes, definitely. Let's talk about the hospitals, Mayor. What is the condition of hospitals in your township? And, the following question is, if the surge was to get bad, are you all prepared with your PPE, ICU beds, and ventilators?
I believe that New Jersey is prepared. I mean, it is difficult to see, especially healthcare professionals and doctors succumbing to the virus after treating it for so long. But thankfully, the levels have not been very high lately. I know that there's a lot of concern over the new strains that are more infectious and the impact that might have. But I do believe that we will be as prepared as we can be for the wave.
Let's go into more about science here. Vaccines, these are being talked about everywhere in this country right now. There is a shortage of supply of the vaccine. What is happening in your township and in New Jersey, if you can give us an insight into it?
Well, the vaccines are distributed from the federal government, and unfortunately, there just wasn't the stockpile that the states expected and were told was coming. And so now it really is up to the new federal administration to try to produce as many vaccines as possible and to distribute them to the states. So the infrastructure in New Jersey is ready to distribute those vaccines. It's just that we don't have the supply coming in yet.
What changes do you think the new administration needs to make to distribute this vaccine rollout faster? Because we need about 70% of the population vaccinated to really fight this disease.
I think that part of it is just managing expectations. I think that it's a huge undertaking to vaccinate 70 to 80% of the entire population, and it's not going to happen overnight. I do think that we need clarity from the federal government as to how long this is going to take, but also that letting us know what they're doing to make sure that they're producing as much as possible of the vaccine to get it to us all as fast as they can.
And this pandemic has been disproportionately impacting Black and brown communities. We've talked about this before on the show. When you look at the vaccine rollout, are you seeing the same trend?
Absolutely. On the one hand, there is a hesitance on the part of some minority communities to be vaccinated because of the history of, very deserved distrust of the medical establishment. But then on the other hand, it just is the case that wealthier communities, and those tend to be whiter populations, tend to be getting access to the vaccine more easily. So we need to make sure that there is an equitable distribution of the vaccine throughout the country, but I don't think we've accomplished that goal yet.
Let's talk a little bit about the economy here, the stimulus that everyone's looking at. How important is that for your township, and how much help do you need from state government and then federal government?
It's definitely very important, particularly for, people who are in the lower income brackets, that they get this help, because it can really mean the difference between them being able to pay their rent, buy groceries, or not being able to do so. So it's very important that the stimulus package be pushed through for those who have lost their jobs, particularly, and for those who are in lower income brackets and really need the help. I also think that we need to make sure that we're keeping our businesses afloat during this period until we do get to the point of having a vaccinated population that can start going to businesses more frequently. So there is definitely a need. People are stretched pretty thin, and I'm very hopeful that the stimulus package goes through, and it should be as ambitious as possible, because if not now, when can we expect the federal government to come through for us?
Right, and just talking a little bit more about the economy, and you just mentioned businesses. Small scale businesses have been thoroughly impacted by this COVID-19 crisis. What kind of help do they need in your township and in New Jersey? And is that kind of help coming from the state or the federal government?
Well, traditionally you would expect that sort of help from the federal government, but seeing that we didn't have a lot of it until recently, really wasn't that much of an emphasis on helping small businesses. The state of New Jersey did step in with grants for business rent, relief, as well as small business grants. And so a number of the businesses in my community did take advantage of that. But, that needs to be something that's continual, as not a one-time benefit. So we really need to have an ambitious plan for how to keep businesses afloat.
Just talking about that, it brings me to the issue of food insecurity, which has greatly impacted the entire nation. How bad is the situation in your township, and what are you hearing across New Jersey when you are talking about food insecurities?
I have to say that I am impressed with the response to food insecurity questions throughout the state and in the local community. People who have the means have really stepped up to donate to food banks and food pantries. Our food pantry in Montgomery, for example, has distributed more than $55,000 worth of gift certificates to grocery stores and food goods and items to families that are in need. But obviously that need is continual. So it's great to see the generosity on behalf of members of the public, of nonprofit organizations, but also the government needs to extend SNAP benefits and other sorts of more sustainable food aid for populations that are in need.
Definitely. And are a lot of these populations minority groups or ethnic groups?
Well, wealth in this country and so in the state does map on to minority populations. And so certainly there is more of a need among minority populations than there is in the general public. But we do see people coming in from all backgrounds to the food pantries because this pandemic and the economic impacts of it have really hit every industry and every income bracket.
Right. Let's talk now about schools, Mayor. I would like to know what has been your take on opening schools, what kind of a school system is happening in New Jersey and in your township, and, are you able to provide access and resources to every child that needs to be educated?
Our school district at the moment is in a hybrid model, though families do have the choice to keep their children at home for all virtual schooling if that's what they prefer. Personally, that is what my family has done. We've kept our daughter at home for her school day, but the possibility is there for hybrid schooling for families that want to send their kids into the physical school buildings. I think that does meet various needs. Those who are willing and able and prefer to keep their kids with them at home are able to do that. Those who prefer to send their children into school are able to do that. I think really what we need to be prioritizing, and this goes back to the vaccine, is getting the teachers vaccinated, because that is definitely a step to ensure that those who are taking care and teaching our children are safe themselves. It really shouldn't be a position that teachers are putting themselves in harm's way to teach the children. So, I personally think that should be a priority in New Jersey and throughout the country. If the plan is to try to get children back in schools as soon as possible, one step in that has to be vaccinating all the teachers.
Yeah, and that's a really important point because they are, a very important part of our society. When you're looking at the schools, Mayor, I'd like to know what kind of safety precautions have been taken in schools in your township. How does an in-person interaction look like in the schools now?
Well, I think that children are actually very dynamic and they're able to adapt, maybe better than parents and adults are. So I've been surprised that children, they just understand that they have to wear their masks, they have to sit farther away from each other. They can't really interact with each other that closely. And a significant, percentage of the student body is doing virtual schooling. So the class sizes are relatively small for those children who have returned to in-person schooling. So all of those things help keep things as safe as possible, but nothing is 100% guarantee. Even doctors who suit up and are so careful have gotten COVID-19. So we put all of these precautions in place, but nothing is 100% guarantee, which is why I really think vaccinating teachers should be at the top of everyone's agenda.
Let's also talk about in businesses, I want to go back to it, restaurants. Today, Governor Murphy announced that the capacity of restaurants in New Jersey can now go up to 35%. Could you give us an insight into why he was able to increase the capacity when we are talking about surge in cases across the country?
Well, the research that has been done, or our experience in New Jersey, has not been that restaurants have been a site of spread of the virus. I think in a lot of places that is the case, especially for indoor dining that is happening in like a bar sort of context where people are sitting very close to each other and different parties are sitting close to each other. But since, the 25% limit, we haven't really seen bumps in increases in infections with that. I guess he thought that it was prudent to allow it to go up to 35%. That being said, I mean, we all know the risks that we're taking when we go out. A lot of people still would prefer to simply order out or cook at home, and that's absolutely fine. But I think that it does make sense to follow the science. If there hasn't been a correlation at 25% to outbreaks, then perhaps it does make sense to help the restaurant industry to allow them to have a little bit more of capacity. Let's see. I mean, this is all a learning experience. We're continuing to learn and decipher what the safest thing is for our state and for the public.
Some of the latest research and study that came out is saying that younger adult population is kind of responsible for the surge in these cases. When we're talking about the number of infections that we're seeing, more than 100,000 a day. Have you seen that trend in the Montgomery Township when you are looking at, opening these restaurants to even a higher capacity? Would that population from 26 to 49 concern you?
Well, I think that a lot of the times when younger people are getting infected is in private residences and parties and things of that nature. So it's not really that socializing in restaurants is where this is happening, at least in New Jersey, where it's been relatively strict. So I think that there are those who would argue it's better to encourage the young people to socialize in as safe of an environment in a restaurant that's spread out or outdoor, rather than them feeling like the only way they could socialize is in someone's basement or something like that. So I mean, it is a balance. There are various needs that the public has, and young people don't always make the best decisions because they're still learning and growing. So I think that it has to come through education of the families and the young people, and a unified message that this is very serious. You need to protect yourself. You can really impact your health and your well-being or your life, and also in addition to that, your loved ones. I hope that message is getting across, but it is very difficult. It's very difficult for those of us who are not in our teens to kind of or 20s to take these messages to heart. So I think that this is continual messaging that needs to be unified across the board. And I am heartened to see the support that we're getting from the Biden administration in mandating masks and just making it clear that this is a serious matter that we need to deal with as such.
What is your biggest worry right now as the mayor? What are you most concerned about when you're looking at the economic and healthcare ramifications of COVID-19?
I think that it's, we need to manage expectations in terms of vaccine distribution. I really think that the public doesn't really know when to expect the vaccine. How are people ensuring that this is being done fairly? I think that as much clarity as the public can get on that, the better. Like how many doses are being created at any given time and where are they going? Because so many of us are waiting, and waiting is tough, especially when we know that the technology is out there or that other people are getting it. So I think it's that people kind of get fed up and they feel like, oh, well, the vaccine is here, so it doesn't matter anymore. And we all know that's not true. We're seeing the continual infections and fatalities from COVID-19 throughout the country. So I think that's my biggest fear, that people just get tired of abiding by the guidelines because they just don't know when they're going to see an end.
Right. I just have a couple more questions left here for you. I'd like your opinion on what's happening with the Biden administration right now. President Biden has signed a number of executive orders right in the first week of his presidency. How are you looking at it? And, how important do you think it was for him to sign these orders?
I think it was very important because there was a lot of damage done in 4 years of the Trump administration, and that signaled that right away from day one, the Biden administration was going to address all those problems. Obviously those were just one step, and there has to be legislation that comes through Congress to really make changes in our government. But I think it was important that he took those steps. At this point, I do think that the primary mission needs to be producing and distributing the vaccine, because there's no way we can move on until our population is vaccinated.
The entire country is surely worried about that. The Muslim ban has also ended. You're a Muslim American and a very proud South Asian. How did you look at that?
That was a huge relief. I think that ever since Donald Trump started his campaign, and it was so xenophobic, so focused on anti-immigrant rhetoric, anti-Muslim rhetoric, racist rhetoric, it's been a cloud over everyone. And seeing that one of his first actions in office was to institute the Muslim ban and to start building a wall that, inexplicably he thought was going to stop illegal immigration to this country, those things really made immigrants and Muslims feel as though we are not welcome, that we're not part of the country, that we're not part of the society. And so to have that lifted and to have signaling from him that it will be a different approach to immigrants in his administration was definitely a huge relief. I think that, there were so many inspiring moments on Inauguration Day, but the fact that he signed that on Inauguration Day itself just made it very, very clear that that sort of perspective on immigrants and Muslims is not going to continue. And I think that that's the right step forward.
And finally, my last question to you has to be, what are your hopes for this new administration, and especially for Vice President Kamala Harris, because she is half South Asian and half African American? I think she also has a lot of responsibility and identity this time.
Yes, I think that, all eyes were on her on Inauguration Day, and she did an amazing job with her remarks and with all of her part in the ceremonies. I think that what we'll see is that she is a great leader, and she has very thoughtful responses to all the different crises and situations that our country and the world is facing. I think that, she is a South Asian American, she is a Black American, but she's also an individual. And so we'll see the individual aspects of her policy perspectives come out. And that's important. We don't all South Asians don't operate as one. All Black Americans don't operate as one. We have our individual values and perspectives, but they're informed by our backgrounds. And I think that that's what we're going to see. And I'm really looking forward to the country getting to know her better and continuing to grow in their respect for her.